Today's video topic is, what is Stockholm Syndrome and who does it affect? Stockholm Syndrome is a psychological phenomenon in which a hostage or abuse victim forms a bond with their captor or abuser. It can occur in any situation where an individual is held captive or abused by another person. Here's what you need to know about the symptoms, risk factors, and treatment options associated with Stockholm Syndrome. Symptoms of Stockholm Syndrome. Symptoms of Stockholm Syndrome can include positive feelings towards the captor or abuser. The victim may experience feelings of trust, affection, or even love towards their captor or abuser, often leading them to defend or protect their captor or abuser from law enforcement or other authorities. Negative feelings towards those trying to rescue them. The victim may feel anger or resentment towards law enforcement or other authorities who try to rescue them from their captor or abuser. Difficulty adjusting to normal life. After being rescued, the victim may struggle to adjust to normal life and experience feelings of depression, anxiety, and emotional detachment. Risk factors for Stockholm Syndrome. Several risk factors can make an individual more susceptible to developing Stockholm Syndrome. Length of captivity. The longer a victim is held captive, the more likely they are to develop Stockholm Syndrome. Age and gender. Victims who are younger or female may be more vulnerable to developing Stockholm Syndrome. Isolation. Victims who are isolated from others during their captivity are more likely to develop Stockholm Syndrome. Trauma history. Victims with a history of trauma or abuse may be more susceptible to developing Stockholm Syndrome. Treatment for Stockholm Syndrome. Treatment for Stockholm Syndrome typically involves psychotherapy, support groups, and sometimes medication. Psychotherapy. A mental health professional can help the victim process their traumatic experience and develop healthy coping mechanisms. Therapy can also help the victim understand the dynamics of their captor-victim relationship and learn to break free from it. Support groups. Joining a support group of other victims of abuse or captivity can provide a sense of community and validation. Medications. In some cases, medications such as antidepressants may be prescribed to alleviate symptoms of depression and anxiety. In conclusion, Stockholm Syndrome is a psychological phenomenon in which a hostage or abuse victim forms a bond with their captor or abuser. Symptoms include positive feelings toward the captor or abuser, negative feelings towards those trying to rescue them, and difficulty adjusting to normal life. Risk factors include length of captivity, age and gender, isolation, and trauma history. Treatment options include psychotherapy, support groups, and medication. If you or someone you know is experiencing Stockholm Syndrome, seek professional help to overcome their psychological condition.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.